Welcome back to This is VANCOLOUR. Last month marked 9 years since British Columbia declared the toxic drug crisis a public health emergency, in which time over 16,000 British Columbians have died as a result of toxic drugs. Have we learned anything? Returning to the show to discuss, the author of the national bestseller Crackdown, Surviving and Resisting the War on Drugs, the co-founder of the Drug User Liberation Front, organizer of the Vancouver Area Network of Drug Users, and the host of the award-winning Crackdown podcast, Garth Mullins.
Hey, Mo.
Garth, hello. Nice to see you.
Good to see you, too.
I want to talk about last year's drug death statistics. 6 British Columbians died every day last year, a staggering amount, and yet we did see a decrease in the number of deaths. By no means is this a win, because it's still so many British Columbians, but what can we attribute that statistical decrease of deaths to?
Well, I think the drug supply is still really volatile. So there's still things that are coming in and going out. You know, it's still based on fentanyl, but there's benzodiazepines, there's like veterinary tranquilizers like xylazine. All this stuff is coming and changing. So that could be it. I certainly don't attribute the reduction to anything policy-wise that the government has done. There's been no intervention big enough to make a difference at the population level. I remember in the 90s when we had another overdose crisis, which was also a public health officially declared emergency. And back then, we would have 400 a year, not 2,500 or something. And that was considered large. So this small reduction is still, in the scale of things, huge. And I just think that we haven't really learned anything. We haven't progressed. We're not seeing the solution to it.
And so I want to go back to talking about that toxic drug supply that you just noted. So you're saying that's really the key determinant of drug deaths that we see. It's not based on any policy that we've seen over the last 10 years.
That's right. It's just, it's the same old thing, right? It's like the police or whatever crack down on, say, heroin, and something comes to replace it. So when you hear Trump or the fentanyl czar saying we got to stamp out fentanyl, that may be well-intentioned, but something would just come to replace it if they were able to stamp it out. The toxic drug supply is not going to go away unless you replace it with something that is known and, say, prescribed as sort of a pharmaceutical version, because drugs just don't disappear. The genie does not go back in the bottle. The toothpaste does not go back in the tube. This is it.
Why don't the illicit drug producers try to create a supply that is less lethal? I mean, wouldn't that make quote unquote business sense for them?
Well, it's that there's no regulatory infrastructure to oversee it, right? Like if there was no government beef inspectors, we would have lots of farmers and lots of beef, but people would be getting mad cow and people would be dying. And right. I mean, if you just have any industrial system operating at scale without regulation, without quality assurance, without testing, without good ingredients, you're going to get this result. So this is really the fact that the government has chosen to just leave it open, a wild west for organized crime to occupy. That's why.
Now, over the course of time where it has been declared a public health emergency, as I said, 16,000 British Columbians and counting, like just horrific numbers. We've seen a lot of political talk about this, whether it's about treatment or harm reduction or safe supply. Has anything actually changed on the ground in terms of being able to protect vulnerable drug users? Obviously, the supply is still illicit, but has anything changed in the last 9-10 years?
Sure. I mean, we know from the Center of Disease Control that harm reduction has actually prevented the deaths from being much, much higher. So safe injection sites, naloxone, needle exchange, stuff like that has prevented things from being 2.5 times more deaths. So that's kind of a bleak way to think of it. It could have been a lot worse. But in that same time, we've seen a backlash against harm reduction that comes from the political right, a very Trumpist sort of fact-free, fear-based backlash.
Which is counterintuitive, right? Because if that one thing is preventing more deaths, that's the thing that's under attack?
That's right. Yeah, that's right. And it doesn't have to make sense. It doesn't, it doesn't have to be rational. It's especially when you have a moral panic that's fear-based. And the drug prohibition in Canada has been racist moral panics all the way back to the beginning. So it's not something new to see the press and people on the right screaming and yelling in this way. We're just living it again. I mean, it's hard enough to fight toxic drugs. Now we have toxic politics involved, so that we can't even have a coherent conversation in public about this anymore.
You said it's racist. In what way are these policies derogatory, or I shouldn't say derogatory, discriminatory?
Well, in 1907, drugs were outlawed in Canada as part of an attack against Chinese migrants, and a big sort of fear amongst some of the political elite that the white race was imperiled and was going to be weakened by this nefarious foreign influence. And then versions of it went on to associate cocaine with black communities. And eventually now we have people who are Indigenous or black dying in greater numbers, being over-policed, more likely to get stopped and searched, harassed, carded, do more time, go to jail, all of that stuff. It falls first and worst on those communities. So, if we want to do something right, just good for our fellow citizens, we have to end this.
Municipally, here in the city of Vancouver, we've seen the city take a very pro-police stance. We've recently had the task force barrage. Provincially, Premier David Eby has been talking a lot about involuntary care, even though voluntary care spaces aren't open either. Federally, you had the Prime Minister, Mark Carney, saying that, fentanyl is not that big of an issue as it is in the United States. It just doesn't seem like there's a lot of movement to do the things that you're talking about in terms of replacing the supply or providing healthcare services to vulnerable drug users. I mean, am I wrong? Like, that seems very
you're right.
bleak.
You're right. I mean, people like Eleanor Sturko and Pierre Poilievre have made the idea of replacing the supply toxic. The very notion of it. I mean, Pierre Poilievre was out here running a campaign, not against a politician, but against Dilaudid, it seemed like. Starting in 2022, shooting videos down in Crab Park and stuff like that, lying to people, saying that the cause of the overdose crisis is woke, liberal, and NDP dope flooding the streets. It's not. It just isn't. People are dying from street fentanyl, which is not provided by the government. They are not dying from the alternatives. In fact, studies that are coming out now show that those alternatives greatly reduce the likelihood someone will overdose. We can't get there, though, not with politics in a way like that.
What do we do then?
We have to organize, right? Like people like Vandu have to reach out, and people at home, wherever you are in your workplace, your trade union, your mosque, church, community group, whatever, there are people in those places who are drug users or who are recreational users who are, at risk. Or there may already be people missing from those places. So start organizing where you are, or we're not going to see the end of this. Or my God, what we could see is I've lived through 2 of these. I don't want to live through 3. I don't want to keep seeing these big, increasing, larger cycles of death coming and going. And we have to ask for more from our politicians, because we have on the right, we have liars that are standing on a stack of our corpses, reaching up for high office. And then in the center, the NDP and the Liberals, we have people who are just gutless cowards who aren't going to do the things that are necessary. Both of those sets of politicians have blood on their hands. Obviously, we need something a lot better than that.
Garth, I appreciate your voice and I appreciate your time tonight. Thank you so much.
Thank you, Mo.
Folks, that was Garth Mullins of Crackdown Podcast. Make sure you pick up his national bestseller, Crackdown, Surviving and Resisting the War on Drugs, wherever you find your books. Now, after a little business, should social media be treated as a vice? Let's talk about it up next.